And as you saw in the weekly email for this week, tomorrow we're going to have a first year tour. I think we're just going to have Senator Donner Jr. because Rep. Gonzalez has to reschedule, so that's fine. And then we wanted to, yeah, spring forward, Tom. I'm sure it was a little rough out there for the waking up this morning. We also shared that the live broadcast for our fifth anniversary, which will be next Thursday, March 20th. So we have a quick poll for you to just let us know how you will help celebrate the fifth anniversary of the 9:30 call. So you should be able to see the poll. So you can come to the live broadcast. We're going to be on our typical Zoom link. And we have two watch parties scheduled. So if you want to host a watch party, we are happy to connect with you about that. And so we'll keep this poll up as folks are joining. Good morning. Oh, we already broke 100, Amy. That's good. A lot of interest in behavioral health, we know, which we also know was one of the biggest issues we heard about 5 years ago, when the 9:30 call first started.
Mhm.
All right. So we have 58% of people who have filled out the poll. So we'll leave it up for maybe 30 more seconds and then I'll turn it over to Amy. And Amy, as you know, the first question that we ask for everyone to share is for everyone to tell us a little bit about you and how you came to be in your current role. And we know you have the team with you. So we'd love to hear a little bit about the team. Okay, I'm
Sure.
going to end the poll. It looks like overwhelmingly people will be joining us on Zoom. We know we have 30 people already RSVP'd for Worcester, so we'll put that link in the chat too. So we're excited. We're excited to talk more about next week. But Amy, I'll turn things over to you.
Wonderful. Thanks so much, Amy. And then thanks so much for having myself and our behavioral health team this morning. We really enjoy coming to all of you to tell us about the things that we've been up to at EEC, especially around supports that have to do with mental and behavioral health. So just to give you a little bit about myself, I am a behavioral health specialist or special education specialist here at EEC, but I am also fortunate enough to be the supervisor of our newly developed behavioral health team. And over the years, I have worn many EEC hats. Prior to coming to EEC, I was early childhood director specialist at out here in Western Mass for the Frontier District School District out here, and ran several different public preschools. Before that, I wore my community hat, and I was the director of a small community preschool out here in Western Mass. And then, what feels like 100 years ago, I was a family child care specialist, where I had family child care here in my own home with about 6 little ones, and really loved that time with those kids and my own children. So I've been really lucky to be able to wear lots of different early childhood hats. And now I work with these wonderful people who make up our behavioral health team. And so I will turn it over to you, Alexis, to talk a little bit about yourself.
Good morning. My name is Alexis Thibodeau. I've also worn many EEC hats. I started off as a preschool teacher as well as private kindergarten, also was a director of a large center. And then from there, I moved on to early intervention. I've also worked in the public schools a little bit. And then most recently, I've done some in-home therapy prior to coming to EEC. And I'll pass it to Chris.
Good morning, everyone. My name is Chris Lloyd. I come to this work from 7 years of experience working in early intervention in Boston. And prior to that, I was a preschool teacher myself. So happy to be here. I'll pass it over to Stacey.
Thanks, Chris. Good morning. My name is Stacey Ware. I am the newest behavioral health support specialist on the team. I started with EEC in late September. I come to the work with a multitude of experience similar to my team. I come from the public school district, managing out of school time programs, doing some central registration. And prior to that, I've worked in multiple other programs, healthy families, and in group and congregate care. I'm excited to be here.
I just want to say it's so exciting to have kind of the behind the scenes team here out in the day, to see you all, meet you all. So Aimee, I really appreciate I know how hard it is to coordinate calendars. So I'm so glad to see everybody here.
Absolutely. Happy to be here. So I will go ahead and share my screen with you all. And okay, the hardest part about this was editing, right? To get it down to the amount of time that we have. So forgive me if we bounce around a little bit in the interest of time, but wanted to just ground us a little bit in the importance, right, of and the impact of behavior and mental health on our youngest learners. So we know as early childhood advocates, as early childhood educators, that we have to be able to center our behavioral health and social emotional learning before we can do anything else with young children, right? We know when we are able to get that right, and when we're able to sort of introduce that early on, create those rich relationships with young children, then the outcomes, those positive outcomes for kids, really have a better chance of falling into place. We know when we have those social emotional learning opportunities, kids are able to better self-regulate. They have more self-awareness. That's the preventative piece when we talk about those behaviors that challenge that Aimee mentioned right at the beginning of this. There isn't a meeting that we're in, there isn't a program that we go to where people are not bringing up behaviors that challenge, right? And it looks, again, like Aimee said, they brought it up 5 years ago. It looks very different now than it did when I was in the classroom, when my colleagues were in the classroom. It has shifted. And so we are doing our best to sort of respond to that. But that's one of the key reasons that we've all come together here to be able to support our early educators. But all of these other things also have a tendency to fall into place when we put those social emotional learning opportunities first and foremost. We have enhanced social skills, those positive long-term outcomes in relationships. And then, of course, we're looking at improved academic performances, engagement, curiosity, and wonder is what that looks like in our young children. But as I said, as we respond, as our team responds to the field, these are some of those current challenges that we're seeing. And these are just sort of, these bubble to the top, but they certainly are not the only ones. When we talk about those behaviors that challenge, oftentimes we are talking about aggression. And so big behaviors, we're not just talking about some defiance or having trouble listening, or things that perhaps at one time we would think about as developmentally appropriate, right? We're looking at really behaviors that where safety comes into play, not only for their peers, but also for teachers as well. So a really different environment. We're talking about a real deficit around social skills, those serve and return engagement moments that we'd like to see with not only peers, but with their educators. It's really difficult to be able to now discern between what's happening at what point, what we thought was age appropriate social skills, to now really not being able to see some of those engagements with young children. Anxiety is something that we're seeing younger and younger, which often manifests in those physical symptoms, right? My stomach hurts, my head hurts. And then, of course, trauma responses. A lot of the behaviors are because of young children and families having trauma in their background. And then at the center of all this is our workforce, right? Who is trying to manage and juggle all of these pieces while still being present and engaged, and an empathetic listener, and in service to young children. And so we need to think about their mental needs, their mental health needs as well, because we're seeing such high ratios of burnout. And so when we think about our goals as a department, as a new team, we really want to be able to bring to programs a foundation of research best practices to support that healthy emotional learning, so that we can try and prevent those behaviors before they show up. We know that oftentimes we're a little bit late with that, but We want to make sure that we're helping to support environments and teachers in a way where they can be front loading and set themselves up for success as we know kids are coming into programs. When we do that, we know that we can reduce the use of exclusionary discipline across the early education mixed delivery system. No one likes to be in the position where they have to ask, or they feel like they have to ask young children and families to leave a program. It's a really difficult situation. It's an emotional situation, but it's an issue. And it's an issue not only in Massachusetts, but across our country, because we know that our national data lets us know that Black and brown young boys are 50% more likely to be asked to leave programs. And oftentimes the behaviors that they're showing as they're recorded as behaviors that challenge are the same behaviors that we're seeing in their white counterparts. So this is an issue that we really need to look more closely at. We provide more training opportunities, or tried to offer more training opportunities around trauma-informed and responsive care. We've had a wonderful relationship with our OCA partners to be able to provide additional trainings. And then, of course, we're always thinking about how do we continue to support our educator wellness. And so I am going to turn it over to our behavioral health team, who are boots on the ground and giving direct supports to programs. And I am going to skip around a little bit, but I'm going to go ahead and turn it over to my team to talk about the work that they do.
Thanks, Aimee. So I'll talk a little bit about the EEC mental and behavioral health resources supports that we're providing to programs, as Aimee said, sort of boots on the ground. So this is a great visual. So you'll see there we have the behavioral health team. That's myself, Alexis, Chris. Aimee also goes into programs. We're regionally based, and so we cover the whole state. We have the early childhood mental health grant. That's external partners that also provide resources, support, training, coaching to programs in the areas of early childhood mental health, exclusionary discipline, as I said, professional development. We have the pyramid model supports. So we're really hoping that programs will utilize these supports in a way to access training, communities of practice. We have our statewide professional development academy. This is a great way, again, to access coaching, training. And so myself, Alexis, and Chris, and Aimee will go into programs, and we can provide resources and referrals to a multiple of these. We can say just the early childhood mental health grant, or we could say our professional development centers, and we will all come together and provide supports to programs. And lastly, we have our Commonwealth Preschool Partnership Initiative. You often hear of it as CPPI. These are supports to programs, to communities, including inclusion and special education. So these are programs that are in the communities that get that children can get services through their public school system. You can jump to the next slide. Thanks. So our role as a behavioral health team. So we can provide resources and technical support. As I said, we can go right out into the program. A program could reach out to us today, and we're trying to get in within a week. Sometimes the early childhood mental health grantees will have a little bit of a wait list. Alexis, Chris, myself, and Aimee will try to get in, kind of meet with the team. We will observe, we'll talk to teachers, we'll talk to the directors. We'll provide, some strategies around positive behavior intervention. We can provide exclusionary discipline policy consultation. So we're trying to help programs have policies that are more inclusive of all children, including children that exhibit challenging behaviors. We're going to collaborate and coordinate our resources, so support between EEC staff and regional teams. So we may collaborate with our quality team, our external partners, and then we're going to continue to develop protocols and frameworks to help implement this work. And lastly, as I said, we'll facilitate referrals to our grantees, and so that we can kind of be a bridge between the program and our external partners. And I think the next slide may go to Chris, I believe. Yeah, thank you.
Thank you, Stacey. So I have the pleasure of sort of doing a brief high-level overview of the pyramid model for those who are not familiar with it. So the pyramid model is a framework. It's not a curriculum. It's a framework that we use to promote quality education and environments that support behavioral health and mental health in classrooms. And it is a framework that helps to create positive learning environments, to work on social emotional skills and support children who have exhibited challenging behavior in the classroom. So if you go to the next slide, so the pyramid model is it's based on evidence-based practice, and it really starts with sort of this bottom level that you see in universal promotion. And so that's looking at whole classroom, what works for all children, and what strategies would help promote learning for all children in the classroom. And so this might include things such as helping greeting all children at the door, or creating spaces in classrooms that are conducive to not running around and things like that. And so thinking about some of the physical space, things like that. So strategies that work for all children in the classroom. And then sort of the next tier up would be sort of that secondary prevention. And that is what is a little bit more targeted for children, for groups of children who might need a little bit more extra support. And so that includes things like targeted social skills groups in some classrooms, or peer groups, things like that. And so those would be more sort of small group, sort of targeted activities for smaller groups of children that need it. And then the top level, sort of the red level at the top, would be more intensive interventions for children who need additional one-on-one supports that aren't being helped as much by the lower level tiers. And so this might include one-on-one supports for children. It might include using visual supports for a specific child who might need it. It might include things like early intervention, things like that, that really work to target one child in particular who might need the additional supports. And this is all undergirded sort of in this yellow area by an effective workforce. And so it's really about supporting teachers and knowing how to manage behaviors that challenge in the classroom. And so really supporting that effective workforce that is going to be working in the above tiers. And we can go to the next slide. And so when we think about sort of what this looks like, sort of boots on the ground, like how we implement pyramid model on sort of the day-to-day, we like to think of this as sort of the big five, which is really looking at 5 key principles that are sort of undergirded by the pyramid model supports. And so this is a ratio of positive versus corrective actions, predictable classroom schedules, routines within routines, intentionally teaching behavioral expectations and self-regulation skills, and intentionally teaching social skills. And some of this can be done, these can be done at any level of the pyramid, but it's really about sort of creating these effective environments to support children in learning, as well as to help teachers to know what to do to manage behaviors that challenge. So from there, I'm going to pass it to Alexis.
Thank you, Chris. So this slide talks about our early childhood, the mental health consultation grant supports. I know that Stacey touched a bit upon it, but these are the things that the grantees can help support not only directors, but as well as educators and families in the classroom. They're able to do classroom observations and offer strategies for creating supportive learning environments. They also are able to train and coach educators. They can also offer guidance for developing that ongoing partnership with families, because we all know that it can be challenging to be able to discuss what's happening with the child in the classroom with families. So being able to guide them in that process. As far as observations, there's 2 types of observations. There can be an individual observation, which requires parental consent, but they can also do an observation, a classroom observation. So that would come in, look at the classroom, look at the dynamics of the classroom, and be able to offer some support that way. And then maybe, again, strategies to how can we have the conversation with the family to be able to potentially obtain that individual consent. They can also help with individualized behavior support plans for children. And the way that they would do that would be utilizing input not only from the educators, but also the parents, because they're the experts on their children, and being able to help them to support preventing those challenging behaviors. They can also help support with referrals to any community-based programs such as early intervention, maybe a neuropsych eval, occupational therapy, but being able to assist with that so that that can meet the basic needs of the children and the family. Again, you would need parental consent for those types of referrals, but they can support in being able to do that. And then our mental health grantees, so we all have different regions, so each grantee would support a different region. So when we look at Western Mass, we have BHN and the Collaborative who work to support Western Mass. We also have Empower, and Empower, I feel like kind of touches upon all of the different regions, pretty much all of our regions except for Western. So that could be Canton, Westboro area, Quincy, Foxborough. Then we also have Community Health Link, which you might know as Together for Kids, and that would be Central Mass. We have MSPCC, which is the Laurel Lawrence, the northeastern region area of the state. We also have JRI, which is the Southeast and Cape and Islands. And then we also have Walker, which is Boston, Metro Boston area. And then we have some new initiatives for this year that we've already been working on. One of those initiatives is developing a toolkit, which has already gone out to vendors. And this toolkit is to be able to support educators in being able to establish behavioral health supports for children, educators, and as well as support with that social emotional learning piece. They're also looking to have the developed program policies that can reduce the use of exclusionary discipline. So as Stacey talked about, not only can we consult with this, but with this toolkit, it's to help program be able to further develop the policies to reduce that exclusionary discipline. We also will be having a supplemental resource guide, and that will provide any type of technical assistance to build reflective practice as well as sustain best practices in regards to that social emotional learning piece. And then also providing training for educators, leaders, and support partners. And then we've also been working on a trauma-informed responsive training opportunities, which our team, as well as other team members and different agencies are taking part in. And that's a partnership with the Office of Child Advocate of Center of Child and Wellbeing. And then we also recently had our STREET initiative, which is Strategic Trauma Responsive Early Education Training. And that's to implement a training series for educators and leaders.
Wonderful. Thanks so much, Alexis.
Thank you.
So, and I've just added a few extra slides here. I will whip through them because I'm just being conscious of the time. But as Alexis said, just last month, we launched our STREET initiative, which is an initiative where we created additional professional development opportunities, very specifically for early educators. And so you can find those modules on our LMS. And I'm going to skip over to this here. These will be, I wanted to have these in the slides because they'll be shared with you. So, but this is an outreach flyer so that you can access those trainings. And they are in English, Portuguese, Spanish, and simplified Chinese. And they have been wildly popular so far. And so we are so happy and proud of this partnership with the OCA. And as we talked about last month, this initiative, we didn't want to be a one and done. And so these LMS trainings and some of the trainings that we've put out as deeper dives are really just the beginning, because what we hope we can do is create more opportunities for deeper dive training so that folks can show up in classrooms and show up for kids with more of a trauma-informed lens. And also think about how are they reflecting on their own practice and perhaps secondary trauma that they've experienced within their work with kids and with programs. And so that's something that you'll hear more and more about. And then these are just some of our ongoing efforts and aspirations. And so we've been really lucky to develop this team and work on these various initiatives, the STREET initiative, and working to obtain a vendor to help us with that toolkit. But these are some of the areas too that we hope to look at within the next year or so to help us really be able to respond and serve our programs better. We know that crisis management and response is an issue. When a child is eloping out of the classroom or there's an emergency, they cannot wait 2 weeks for somebody to come by. They need somebody in that moment. And so how can we help develop those resources? And then I'll just hone in on that middle one again, those targeted support for early childhood educators. We talk about that a lot through reflective practice. And so would love to be able to expand our opportunities to support not just programs and kids, but also educators, because without them at the center, being present and being well, and feeling supported, all of these other things are just going to fall by the wayside, right? We're going to have a really hard time doing a good job to be able to support kids if we don't put our teachers and our educators at the center of that support. And so hopefully we hope that you'll be able to find some of this information helpful, and some of these ongoing efforts, some expanded supports will be more to come, and we hope that we can come maybe in a few more months and share with you what else we've been up to. So there is more information on those slides that Aimee can share, but I wanted you all to have that. So yeah, we did it. It's 10 o'clock.
You did it. Thank you so much. And I think there's lots of questions in chat. And what we do is we'll send Aimee and the team the whole chat. But almost every day we get somebody asking, like, can we see the slides? Everything is available. I'm going to show you. This is the follow-up folder. And you can see there's the flyers, there's the slides. And then we do have our YouTube channel as well, where we're recording everything. And I think we recorded the street 9:30 call. So we'll if you go on our YouTube channel, you can look at that. We would love to have you come back anytime. On Wednesday is sharing the mic, which is, our former updates from the field. So I think what we'll do is also maybe collect all the questions, put them on a Google Doc so that you can get them and we can add any other questions that people
Wonderful.
might have on Wednesday. Thank you, Sarah Volkanot, for adding everything to the chat. And I think there's also a lot of talk about ratios and how that all plays into this. So we would love to have you come back anytime. It doesn't have to when you have something new, even just to kind of hear from folks. And yes, thank you, 9:30 callers. A lot of appreciation in the chat as well. Okay, Kim, I see the link's not working for you. Kim, why don't you email me so we can just make sure you can get in. Join me in thanking Aimee and the behavioral health team. I think somebody also acknowledged like how wonderful it is to see EEC growing and building and getting stronger with all of these resources. And Aimee, I don't know if you can also put your email in chat. There were some asks about that.
Absolutely. And I was going to say too, Aimee, happy to put that in the chat. And then I didn't get to it, but the very last slide has all of our contact information.
Oh, perfect.
So depending on where you sit, if you are always welcome to reach out to me for absolutely anything, but certainly you can reach out to any one of our behavioral health team members to help you navigate sort of next steps within your own region. So
great.
Those are in the slides because we want to hear from you. So
thank you so much. We so appreciate this. We know this is a really important part of early childhood, and we know that people need help. There was also one of the first questions was about this gap between early intervention and other services. So that would be great. If people know any speakers that could help us talk through that, we would love to focus on that too in the 9:30 call. Oh, wow. Someone's from Santa Monica, California, where it's 7 a.m. All right. Thank you so much for joining us. Tomorrow, we'll have our first year meet and greet of newly elected legislators. Wednesday is sharing the mic. And then Thursday is, let me look at the calendar. Thursday is, we're going to hear from the Department of Public Health and about Title V, and they have listening sessions. And a short video to watch. So we will see everybody tomorrow. Thank you so much for joining and have a good day.
Thanks so much for having us, Aimee.
Sure.
Much
Thank you,
appreciated.
everyone.
Thank you.
Have a wonderful week.
Thank you. Thanks. Bye.